Welcome everyone to the Be Wise quarterly webinar. This is Kimberly Enner with the Utah Department of Health Be Wise program, and I work with the health coaching portion of Be Wise. Let's see. So today's agenda, we're going to go over some program updates, really just one program update, some data collection measures that we want to make sure we're taking, and then the bulk of our discussion today will be on risk reduction counseling versus health coaching. And then we will talk also about how to use assessment questions during the health coaching session. So our program update is we have one new policy. I know it says new policies, but really we're just announcing one new policy today, which is the waist to hip ratio. So CDC has, I apologize for that. CDC has loosened up on their requirement for the waist to hip ratio, and in turn we will do the same. So we are no longer required or requiring to gather the waist to hip ratio. However, in the database, you will still have to click refuse for those clients who do not enter a waist to hip ratio value. And that will be the case for a little while with some database changes we're going through. So just know that if you want to collect that, you're more than welcome to. We'd love if you did, but we are no longer requiring that you gather that waist to hip ratio data. So we are asking, as part of data collection, we want to ensure that we are getting the same data, just for some data collection measures, that we ask the questions as stated in the database. For example, we would ask how much fruit do you eat in an average day, and not, you get about 3 cups of fruit a day, right? Really what we are getting at is we want the client to be able to answer honestly and not to feel like they need to answer a certain way. And so when we ask something like, how much fruit do you eat in an average day, it's really a different feeling. It's allowing the client to say whatever they really do versus giving them that pressure of assuming how many servings they eat a day. The explanation obviously will be necessary in some cases. So if you need to ask or clarify, that is very appropriate. We know that sometimes we need that. And sometimes we need a lot of education as to what a serving is or what vigorous activity is. That is appropriate. So please educate and make sure that the client is understanding the question so that we can get the data that we are asking. So if the client gives you information in the midst of conversation, we really would like you to please restate it to the client to make sure you're all on the same page and that you're understanding what the client is saying. So if you're talking about vegetables and you say, well, I'm a lot better with fruit, I probably eat 3 or 4 servings a day, then you could say, so I'm hearing you eat about 2 cups serving of fruit a day. That's correct. And then have them verify that. This is just so we make sure we're collecting the same accurate data statewide across Utah. Also, we are wanting to round. So we recognize that the database only allows for whole numbers, and things like weight and height and cups of fruit, you will have fractions. We ask that you round above 0.5, you round up, and below 0.4 or below, you would round down. We recognize that fruits, for example, servings are rounded to a cup when one serving is actually a half a cup, and that is the data requested from CDC. They want that data in full cups and not half cups. So that is why we use whole numbers and we're not putting in fractions and numbers. So here we go into our bulk of our discussion today, which is risk reduction, counseling, and health coaching. I know that sometimes there's a lot of overlap and can be some confusion over who does what happens when, during the client's experience. So hopefully we hope to shed some light and help you in this area. So it is important to note that risk reduction counseling and health coaching are both required components of the BWISE program. Now usually it's not always the case. The screener or nurse offers the risk reduction counseling. For example, they would offer it after their cancer screenings or as they are telling them the results of their screening. Health coaches may offer risk reduction counseling as part of their coaching session with a caveat of asking permission first, and then we'll talk about this a little bit later. But it's important to understand that risk reduction counseling is not health coaching. So I know that as medical professionals, we're really comfortable, and health promotion professionals, we're really comfortable in talking about risk reduction. This is where you are, this is your risk for developing X, Y, and Z, and here's how you need to, what you need to do to decrease that risk. That has an appropriate setting. However, it's important to know that when a risk reduction counseling session does not count as a health coaching session. Okay. So really, I want you to be thinking, am I offering coaching or doing risk reduction counseling when I'm, interacting with my client? So although there are similar elements, risk reduction counseling and health coaching are really distinct and they're different. Although there are some similarities, we will talk about that. Let's start with risk reduction counseling. And what is it? So this comes from the CDC Technical Assistance Guidance document. The CDC gives us how to carry out BWISE in our state. So it says, under risk reduction counseling, participants must receive screening results, interpretation of the results, and recommendations in accordance with national guidelines. This information must be provided both verbally and in writing. So every client that comes in receives their screening results verbally and in writing, what those results mean, and some things that they can do to bring their results within normal ranges. So things that are included as we're offering risk reduction counseling is we'll discuss the screening results and arrange for follow-up care for women, especially with uncontrolled hypertension. We want to reduce barriers to understanding their treatment, receiving medication, medication adherence, particularly for hypertension. CDC has a focus on hypertension during this current cycle. Also, we want to assure that each woman understands her own cardiovascular disease risk. So that should also be a discussion during the risk reduction counseling in accordance, in hand with their screening results. So we also, really important, offer options and not directives. So for example, if we're talking to a woman who has high blood pressure and we want to let her know things that she can do to reduce her risk, we would give several examples. We wouldn't just prescribe a low-salt diet or just exercise. We would say, here are several things you can do to decrease your blood pressure. You can go on a low-salt diet, you can increase your physical activity, and then you can continue on giving several different options. And then this is a really good time in that discussion to refer the client to health coaching. In risk reduction counseling, you do not need to set goals. Leave that to the health coach. And so if you are one and the same person offering risk reduction counseling and health coaching, this would be an appropriate time to switch into that coaching role. And I would state that very clearly so the client knows there's a role change for you. And you're going to be doing, pace will change a little bit of your time together. You might say something to the effect of, here are several things you can do. Is there anything that interests you from what I've told you? Or do you have any questions? And then you could go into health coaching from there. If not, if you refer to a separate individual for health coaching, you could say, we have a health coach here today who would love to talk to you and help you kind of make an action plan on how to help bring your values into normal ranges. Or some areas it's just part, they don't tell them they're going to go to a health coach necessarily, they just go to the health coach and the health coach takes over from there. They don't even really ask if they want to. That is also fine as well. So we're going to start, now that we've talked about risk reduction counseling, talking about health coaching. And I'm going to start with what health coaching is not, so that we kind of get a few things out of the way, and then we'll talk more about what health coaching is. So it's really important, especially as we ask the mental health questions, to realize health coaching is not therapy. So if our client is emotionally or mentally unwell, we need to refer them to someone who is qualified to help them in that area. It is important that we realize that we are not qualified mental health practitioners. And so this is an area that I would really encourage each of you to really find out what community resources are available in your community to help clients who have emotional and mental issues that they need to talk to someone about. So that health coaching is not therapy. It's easy to get into that, but it's important to realize your boundaries there. Also, as we've talked about, health coaching is not risk reduction counseling, where we educate on risk for disease, we tell them how to follow up, and then we tell them things that they need to do to help be compliant with their treatment plan. That is risk reduction counseling. It is not health coaching. There's also, health coaching is not health education. There obviously are times where it's appropriate during a health coaching session to educate. However, this should be very minimal, and education is not equivalent to coaching. So it's important to realize that in health education, we often analyze problems and barriers. What's preventing you from being able to exercise? When in coaching, we focus on what are you able to do to exercise right now? And we work with what they are able to do. We also don't prescribe solutions or recommend goals. You can help brainstorm and create a list of options that your client can then choose from. But to recommend a specific goal is not health coaching. Also, to teach new skills, there is a time and a place for that, but it's important to know that as health coaches, we are not there to teach them new skills. We are there to help them pull out their motivation and recognize things that they can or not able to do to make beneficial changes. So what health coaching is, this also comes from the CDC Technical Assistance Guidance document. It says, health coaching is a collaborative, patient-focused approach to prepare patients to take responsibility for their health and well-being. So in other words, we guide patients to help them make changes to improve their health. Health coaches help people move through the stages of change with the help of motivational interviewing. So we're not telling them, we're not educating them. We are guides and facilitators to help them discover what they can do themselves. So we are experts at coaching. And if you feel like you need some additional resources, please let me know. We encourage personal responsibility. We want the client to take responsibility for their own health. That's why we don't prescribe certain goals, because that's not taking a personal responsibility on the client's part. It's more, they take on more responsibility as they decide what they want to do and how they will do it. We also focus on their strengths and things that are going well, their wellness. So if we use their strengths and highlight those, then it will help them increase their self-efficacy. And it will help you coach them in a way that they can feel your self-confidence in their abilities. We help them discover for themselves what they are able to do at that time and their motivations. We help guide the goal process. We increase self-efficacy through highlighting their strengths and what they're doing well, things that are going well, and to help them have success. So when they have success, they have higher self-efficacy. We help the client find their own answers and create possibilities for themselves that they may not have seen before. And we ask open-ended questions. What I should add to this list is we listen and we reflect. And we don't try to have, it's really hard to put off your underlying script as your client is talking. We ask open-ended questions and then we listen and let the client know that they are being heard. So for an expert approach, we oftentimes are comfortable in this expert approach. This is where we are in a lot of other job duties we have, is in this expert approach. We are the authority. We're there to educate. We tell them, especially when they come in for a visit, you're going to have abstinence day, your breast exam, your blood work, and then we're going to talk all about it. So that agenda is really defined by the expert. And sometimes as the expert, we feel a responsibility for the client's health. We feel like we are responsible that they know and do certain things. We want to solve their problems. So we want to talk about barriers and how to overcome those barriers. We have the answers. We can give suggestions and, this is all expert approach, right? What we're used to is very different from the coach approach, which we are really trying to emphasize, is that you become a partner as a coach. You become a facilitator to help them change. You bring these out of the client. You help have the client set the agenda. What do you want to get out of our discussion today? What kinds of things do you want for your health within the next year? These are questions you can ask that will help the client set the agenda and help you understand the client's expectations. Then we foster possibilities. What can they do now? We can help brainstorm and create a list of ideas that maybe the client has not thought about. And we do this in conjunction with the client, not for the client. So if you're going to generate a list of ideas, half of those at least ought to come from your client. And then your client can review that list mentally, or then if you want to write it down, and see which ones spark their interest or resonate with them. We focus on what they are doing well. We bring that out and help them to see they are having success in other areas of their life, so they can have success with their health too. Or they're really good with their diet, so they can have success with exercise. We help co-discover answers, and we learn from the client's story. We learn how we can best help the client as we listen. So the following slides are going to be several phrases or something that you might hear as a client is in the office. And what then we will do is discuss, is it risk reduction counseling? Is it health coaching? Is it both? Or is it neither? So here's the discussion. Your fasting blood sugar is 107 and in the pre-diabetes range. Let's take a look together at the recommended numbers. Your risk for developing full diabetes is higher than if you were reading in the normal range. Do you have any questions about this? So if we were going to say where this falls, it would be risk reduction. This is where we're telling the client, here is where you are, here's where the normal range is, and here's what that means for you. This is your risk. And then a really key part is to ask, do you have any questions? So this is where kind of the coaching skills and the risk reduction skills overlap a little bit. We always want to check in with our clients and see where they are. Do you have questions about your blood sugar? Check in, see what questions they have or what their thoughts are. And that will help you in offering risk reduction. Okay, the next slide here. Your BMI is 30, which is obese. I am sure you want to work on your weight. How much weight do you aim to lose? So, if you were to assign, if this is risk reduction, health coaching, both, and neither, it would be neither. So your BMI, which is 30, which is obese, that is an appropriate thing to tell the client in that you are giving them the results of their screening. Now, the next part is really where it derails. I am sure you want to work on your weight. How much weight do you aim to lose? This is an assumption. The client has not set any agenda here, and we are telling them and prescribing what we want them to do. Now, we cover it up by saying, I'm sure that's what you want to do, but really it's what we want the client to work on. And we're just putting that on them. And that is not risk reduction, and it is not health coaching. So really, something like this doesn't have much place in the BWise program. You can ask, if we were going to change this to risk reduction, you could say, your BMI is 30, which is obese. Do you have any concerns about that? That would be an appropriate way to change and have it be risk reduction. Okay, the next slide. Based on our review of your BMI level today, you mentioned that you wanted to lose 2 pounds. What, if any, changes could you make to reach this goal? So if we were going to assign where this falls in a flow of a client experience, we would say it falls under health coaching. So we say that we recognize the client has expressed interest in losing weight, and then we ask if there are any changes that they could make to reach this goal. This phrase, what if any changes? What if any? That is really key in health coaching and motivational interviews. We are again giving the opportunity to the client to set the agenda. Do you want to make any changes? If so, what changes do you want to make? We're not saying they need to make changes or they should make changes, but we're offering that. Is this something you're interested in? And if not, that's okay, because we can go on and make the exit. Okay, the next slide. Wow, your busy life as a parent really makes it challenging to make time for exercise. What would need to happen in order for you to feel more ready in the future? So if we were going to assign where this would fall, it would be in health coaching. So your busy life as a parent, we're reflecting, we're hearing that they are really busy. Things at home are busy for them, and it makes it difficult to get exercise. Then we are asking and we're helping the client discover some possibilities here. What would need to happen for them that make them feel more ready? So then the client kind of knows where they are and what they need. And if it's something they can't deal with right now, or something that's out of their control, then there may be something that they feel like that is within their control that they can pursue. If there are things that they can make happen that are within their control, this kind of question would help them troubleshoot through that and know to get to a point, to get to that point in order for them to exercise. Okay, the next sentence. We don't want to be a hunchback old lady. That's why we need to get exercise. So this falls under neither risk reduction or health coaching. What we are doing in this kind of phrase is putting a value on a behavior. Now that client may or may not value being hunchbacked when they are older. That might not be their motivator to get exercise. Also, when we are talking about if we're trying to do this in a risk reduction, we need to stick with disease specific. So if we are talking about exercise, we talk about it in reducing blood pressure and cholesterol levels, right? There are other ways we can talk about exercise that are really non-judgmental. If we're talking about health coaching, if we find out from the client why exercise may be important to them, or if that's even something that's on their radar. So to impose something like this in our clients really is not appropriate and would be right for them. I really discourage women to set a weight loss goal. What can you do that will help you lose weight? So if we were going to assign where this would fall, it would be neither risk reduction or health coaching. The intent behind this is really good, that we want to focus on input goals. What will you do that will help you lose weight, and not output goals, the weight loss, right? And so this is really almost there. And I, as a coach, would not want to just leave my client with a weight loss goal. I would want to have this further discussion. So if the client says, I want to lose weight, then this question here is perfect without the first sentence. Client says, I want to lose weight. You can ask, what can you do that will help you lose weight? So let's get some specific activities that you can do. So it's that question there is really appropriate, but to discourage a weight loss goal, we want the client to set their own goals, and we can guide them. But we don't want to encourage or discourage the things that they are working on or choosing to work on. Because, let me continue that thought, because it is okay if they want to work on something that you might not find the priority. Because once they have success, it will bleed into those other areas of their life, and it's all interconnected. So feel comfortable being uncomfortable, and feel comfortable that the client can choose with your guidance. So the next sentence, your cholesterol is 217, which is high. High cholesterol puts you at risk for heart disease. What questions do you have about that? If we were going to assign this, it would be risk reduction. We're telling the client where they fall and what their risk is, and then we're checking in with them. This is a very clear, concise example of risk reduction. You said that over the past couple of years, you have watched your blood pressure creep up. What are your concerns about that? If we were going to assign, I apologize, where this falls, it would be both. This is appropriate in both risk reduction and health coaching. So you're reflecting that you're hearing this concern from your client, that they're watching your blood pressure creep up, and then you're asking, what are your concerns about that? So this is an appropriate discussion to have in either risk reduction counseling or health coaching. So if we were going to go through a sample clinic, I will use the most common scenario, and when you talk, please think it through for your own clinic. But a client comes in, they fill out their paperwork, they receive their screening, then the nurse goes through their screening results with them, educates them on what that risk is, sets up necessary follow-up appointments, and then refers them to the health coach. So that's kind of a sample clinic flow. If you have questions about that, please don't hesitate to call us. We'd be more than happy to clarify anything for you. So now we're going to talk a little bit about the BeWise assessment questions. So when I refer to the BeWise assessment questions, I'm talking about the questions that ask about their physical activity and nutrition. Those questions, that's what I'm referring to as the BeWise assessment questions. So again, we want to ask the assessment questions as they appear in the database. And again, explanation will be necessary in some cases. So if a client doesn't understand what a serving size is, of course, please educate them on what a serving size is so that they can answer the question in a valid way. So I want you to be thinking about how you use the BeWise assessment questions in your health coaching session. So my first question is, why do we even have health assessment questions? There may be because CDC says so, because UDOH tells us we have to, because the database makes us, or because it's very important to health coaching. I would say that all of the 4 reasons listed are reasons why, but the most important is that the health behavior assessment questions are vital to health coaching. If you were going to go out on your own and be your own health coach, you would still ask health behavior assessment questions, because this gives the client a safe space to let you know where they are when they are asked correctly. So when we're putting assumptions and judgments in the questions, that does not really give us an accurate view. We want the client to have a safe space to let us know where they are with their health behaviors. There are other things we learn as we ask the health assessment questions. We learn about the client and what they're doing well. We are piqued or tipped off as to what areas the client may show interest. This happens when you ask them orally. This is really hard, if not impossible, to get when they are filling out these questions on paper. Also, health behaviors that may be impacting screening numbers. These are things that you can find out through asking the health assessment questions during our health coaching sessions. So we're going to go through each of these reasons or things that we learned from the health coaching assessment questions. And the first, again, is to learn what the client is doing well. When we highlight what the client is doing well and let them know they are succeeding in certain areas, then that success is likely to breed success. And so we want to highlight without cheerleading. So when I talk about cheerleading, I'm saying, way to go, that's awesome, I'm so proud of you. You did such a great job with that. The reason why we don't want to cheerlead is because we want our clients to do and act according to them, not to elicit a certain response from their health coach. They shouldn't be doing or not doing things to get approval from their health coach. That is not the role of a coach. The role of a coach is to highlight, to help bring out, to help the client discover for themselves why they want to do it, and not because we are cheerleading them. So if we were going to highlight, we could say something like, it sounds like you are doing really well with your diet. We're acknowledging their success without cheerleading. We're letting them know you're doing a great job there. But this kind of statement isn't going to make the client change to get your reaction. Also, when we highlight what the client is doing well, it increases self-efficacy. So they are more likely to try their goals when they realize they are doing some things well. And maybe even as a coach, you can leverage those things that they are doing well and those supports they have in place to succeed in some areas and put those kinds of things into another area the client would like to work on. Another reason why we ask assessment questions is to know what areas the client will show interest. And this is, again, when asked orally. So the client will often let you know where they stand with different health behaviors if they're asked about them. And I'm sure each of you have your experiences with this. As you're asking the health behavior questions, they will give you additional information more above and beyond what the question asks. So when you ask about how many minutes of moderate or vigorous physical activity do you get, they may say something like, I really know I need to be getting out more and exercising, but I just don't know what to do when it's so cold outside. And so you know that that's something that they're thinking about, that they know they need to do, but there's something that's stopping them. And then you can help create some possibilities on what they can do during the cold weather. The other thing, when we ask health behavior assessment questions, we learn of health behaviors that may impact their screening numbers. Now, I want to issue a warning here that even though we may see this as a health coach, we never prescribe or assign goals. That is not health coaching. In health coaching, we can educate, but we do it with permission. So if you are going over with the client their screening numbers, and they have high blood pressure, and that's something that they want to work on, but they honestly don't know what kind of changes to make to lower their blood pressure, you can offer some information as long as you ask permission before. So saying something like, I have some information that you might find helpful in lowering your blood pressure. Would you be interested in hearing it? That allows the client to still remain autonomous, to remain in the driver's seat, and to let you know where they want to go. And so if they change their mind and they say, no, not really, then you know to go a different route. The blood pressure is not what they want. Now, in my experience, when I ask permission, I've not had anyone turn me down, but it really lets them know that they are in control of what's happening in the coaching session when we ask permission. You can say things like, I have a suggestion, may I offer a suggestion, or I have some knowledge or tips, would you be interested in hearing those? And then, of course, we always offer more than one option. We don't just offer that initial one only thing. So if we're going to talk about lowering your blood pressure, we better have the minimum 3 options, things they can do. So we're not going to say just because they have a high sodium intake and high blood pressure that you need to reduce your sodium intake, because that's not the only thing that could reduce their blood pressure. There are many things, and even if you prescribe that goal, that may not be successful for them because people are less likely to work on things when they are not ready to and when they were prescribed that goal as opposed to when it came from them and it was their idea. So one thing I want to make clear is in your follow-up coaching session, you use the same skill set as in the initial coaching session. So if you are thinking that your goal review is just to call and see, are you doing it? Check it off the list. That is not a health coaching session. What a health coaching session is you sit down with the client, you talk about where they want to go, you have them set the agenda, and if they want to continue, that is fine that they continue with the goal that they set during the first health coaching session. But please understand that health coaching happens in order to be compliant with the Be Life program. Health coaching happens with each subsequent dose. So at month 2, at month 3, at month 6, and for life at month 9. That needs to happen with each follow-up. It's not a separate skill set. So if you have questions about that, we invite you to call or email us, and we'd be happy to walk you through that and clarify some things for you if that is needed. So again, that is our overall webinar today. Please remember that the waist-to-hip ratio is no longer required, but you will need to enter refused or a value into those fields. That health coaching and risk reduction counseling have some similarities, but they are different. We can't do risk reduction counseling with a health coach and health coaching session. But obviously, every client needs to receive both risk reduction counseling and health coaching. And to the best of your ability, ask those health assessment questions as stated in the database, and then to use those health assessment questions to guide your discussion. Again, if you have any other questions or concerns, please don't hesitate to call or email. We'd be happy to help in any way we can. Thank you again for participating on our webinar.